In my first video on dry eye disease, I had provided a general overview on the topic, and now it's time to dive a little deeper into the classification and pathophysiology. In this video, I'll be sharing the nitty-gritty when it comes to classifying dry eye disease. At some point at your visit with your optometrist, we may have said a few terms that went in through one ear and out the other when discussing your dry eye. It's time to bring some of the most common classifications of dry eye disease to the forefront and not just an afterthought. Hi, my name is Dr. Natalie Chai. This channel brings you the latest science-based education and treatments in dry eye, myopia management, and specialty contact lenses to help you understand why it should matter to you for optimal eye health, function, comfort, and even beauty. Dry eye disease is a huge umbrella term used to cover a broad spectrum, and I mean humongous. As I mentioned before, diagnosing correctly the cause or causes of dry eye disease is absolutely paramount to choosing the right treatment to increase the probability of the patient responding successfully to that treatment or treatments. At the start of scripting the content for this video, I started out thinking I could lump a few things together, but I quickly found out it was not going to be possible. The video would probably be hours long, and we don't want that. So my goal is to always simplify the research, but sometimes we can run into trouble when simplifying it too much. I'll be providing more content to how optometrists reach the diagnosis of what type or types of dry eye a patient has. So I want to draw your attention to a few schemes in my introduction video to dry eye. So do you remember this figure? This is the classification scheme we were introduced to, and also this figure, which is the vicious cycle scheme. So we'll be taking a much closer look at both of them together today. Let's first define a couple terms. Classify, to arrange a group of people or things in classes or categories according to shared qualities or characteristics. Here comes a pretty big word now, pathophysiology. Pathology describes the abnormal or undesired condition, whereas pathophysiology seeks to explain the functional changes that are occurring within an individual due to a disease or pathologic state. Now, the reason why I wanted to talk just about classification is because it serves to guide diagnosis and therefore treatment. This improves efficiency significantly and patient satisfaction because their eyes are responding to the actual treatment. So let's break it down together. We will focus first on the 2017 TFOS DEUCE-2 classification scheme. Furthermore, let's just focus on that bottom portion. This represents the etiological classification of dry eye disease. It highlights the two predominant categories, aqueous deficient dry eye, or ADDE for short, and evaporative dry eye, EDE for short. If you were to take a look at past schemes, these categories have been relatively consistent. The features of this scheme was all intentional, even in the way that the colors were and also where the words were placed, to illustrate key and important changes. So here's a summary. Number one, these two categories are non-mutually exclusive. Previous schemes gave the impression that a patient fell into one or the other. Number two, most patients with dry eye disease have a mixed or hybrid etiology or cause, having the scale tipped more towards EDE. Number three, epidemiological and clinical evidence demonstrate that dry eye disease is predominantly evaporative in nature. This is reflected in the greater area devoted to EDE in the scheme here. And lastly, number four, while it is possible that aqueous deficient dry eye can occur without obvious signs of evaporative dry eye and vice versa, as dry eye disease progresses, it is increasingly likely that characteristics of both ADDE and EDE will become evident. Let's further look at each one individually. Aqueous dry eye disease describes conditions affecting lacrimal gland function. In the TFOS DEUCE-2 pathophysiology report, it goes into excruciating detail on further subclassification relating to a vast range of conditions. Aqueous dry eye disease is generally subdivided into two categories: Sjogren's syndrome dry eye, SSDE, and non-Sjogren's syndrome dry eye. So what is Sjogren's syndrome? It is an autoimmune disease where your immune system attacks the glands that make tears and saliva. Unfortunately, it usually afflicts females more. So most people will not only say that their eyes are dry, but that their mouth is also dry. Everything is dry. Everything. Here is a list of all possible causes of dry eye disease under the category of aqueous deficient dry eye. I'll be going into more details on some of the more common conditions underneath aqueous deficient dry eye in separate videos. Secondly, evaporative dry eye is recognized to include both lid-related or intrinsic evaporative dry eye and ocular surface-related causes, extrinsic evaporative dry eye. Here's a list of the possible causes of dry eye disease under the category of evaporative dry eye. And again, I'll be going into separate videos on some of the more common ones that we see on a day-to-day basis. Now, if you're looking at this list and you're wondering how does that cause dry eye, let me know in the comments below. Now let's look at the upper portion of the scheme, which is a key addition when compared to the scheme from the 2007 TFOS-DED report. This provides a clinical decision algorithm beginning with the assessment starting with symptoms, then following by a review for clinical signs of ocular surface disease. Just because a patient exhibits both symptoms and signs of dry eye disease, what this scheme suggests is that we can't just automatically assume it is caused by true dry eye disease. The scheme shows that there are other ocular surface disease that can mimic dry eye. So this is where there are other triaging questions and ancillary testing that are required to distinguish this category from true dry eye disease. Symptomatic patients without demonstrable clinical signs do not fall into the dry eye group. So these are people who come in and they say that their eyes are super dry, painful, sore. So these are their symptoms. But when we look underneath the microscope, we see a perfectly healthy eye. So for many years, we were left with just scratching our heads and just not knowing what is happening, and we felt so helpless that we couldn't help our patients. Now, these are differentiated into what we call preclinical dry eye or neuropathic pain or non-ocular surface disease. Now, the other side of the spectrum is true as well. These are individuals who are asymptomatic patients exhibiting signs. And so these are people that they're fine, there's no complaints whatsoever when they come in. However, again, when we look underneath the microscope, we're saying, oh my gosh, your eyes are so dry, how are you not feeling anything, right? These certain patients are further differentiated into patients with poor corneal sensitivity or those with prodromal signs who are at risk of actually developing dry eye disease with time or with a certain trigger, as in refractive surgery or laser surgery. Sometimes those things are just that trigger point to just start that inflammatory cycle. Let's take a moment to look at the vicious circle scheme. A pivotal proposition from the TFOS-DED report was that all dry eye enters a common pathway where tear hyperosmolarity and a chain of inflammatory events create a vicious circle. In this cycle, dry eye disease can be thought of as an autonomous, self-sustaining disease state disconnected from its initial causes. So as you can see in this scheme, there are basically 3 circles. So the outer circle are initial trigger points to one entering into the cycle. Again, they are not mutually exclusive from each other, but rather connected to one another. Major examples of causes that can stimulate the vicious circle include Sjogren's syndrome, corneal surgery, low humidity, and contact lens wear. Now, if you take a look at that middle circle, it describes further the pathology of dry eye disease. The TFOS-DED report confirmed that the core drivers of dry eye disease are tear film instability or imbalance, tear film hyperosmolarity, apoptosis, or otherwise known as the programmed cell death, and inflammation. And lastly, the innermost tiny circle focuses specifically on the interaction between meibomian gland dysfunction, or MGD, and dry eye disease. Now, this gave rise to what we call the double vicious cycle. In the vicious cycle of MGD, there are 4 sequential events that complete and close the cycle. Stasis of the meibum or oil inside the gland, bacterial proliferation, release of lipases and esterases. Now these are enzymes that break down the oil, and increase meibum or oil, melting temperature, and viscosity or the thickness of it. Although inflammation initiates entry, it is actually the meibomian gland changes, starting with the blockage and then the dropout, that connects the two vicious cycle of meibomian gland dysfunction and dry eye disease together. These circle schemes are valuable in helping us understand how complex the mechanisms are underlying dry eye disease and meibomian gland dysfunction. Fundamentally, this acts as a tool to focus and guide therapy. This scheme illustrates how different therapies can be used to interrupt the vicious cycle. As you look at this scheme, your optometrist may have already counseled you on some of these therapies like lid hygiene. And lid hygiene includes, things like warm compresses, eyelid massages, and lid scrub. So let's summarize together what we learned today. Number one, as you can see, by following the algorithm of the classification scheme, it appears that the diagnosis of true dry eye disease is actually a diagnosis of exclusion. So what that means is we get to the diagnosis of true dry eye by a process of elimination. Depending on the functional diagnosis based on the correct usage of the algorithm, treatment actually varies pretty widely. Number two, the vicious circle scheme allows us to understand why, once the cycle is started, by having a compromised ocular surface, allows this vicious cycle to basically keep going on forever, even if the initial cause has been removed or reduced. Number three, the overwhelming majority of us have multiple entry points into the vicious cycle. Now, how many of us actually wear contacts, who work in a dry work environment while having seasonal allergies, so we have to take an antihistamine like Reactin with a well-known side effect of causing dry eye? Get my point? Number four, the double vicious circle scheme focusing on meibomian gland dysfunction and dry eye disease hopefully demonstrates that meibomian gland disease is a true disease with long-term functional consequences and is more than just a simple dysfunction. Final thoughts. So I wasn't kidding when I said this was a ginormous section of the report. I personally felt I was able to provide a better explanation to some of my patients, especially those who are unable to find a satisfactory solution for years. So I hope you learned something new here today. There's a lot of information, I know, and hopefully that was as simple as I can get it to you through YouTube. And so if you have any questions, please let me know on the comments below. As I mentioned before, through future videos, I will be going into certain details on common conditions that cause dry eye. And of course, in future videos, I'll be going into more of the fun stuff, especially when we talk about the actual hands-on with diagnosing, treatment, and product. That's it for me. Thank you so much for choosing to spend your time with me. As usual, I hope that you learned something. Make sure to click that subscribe button, especially if you are new to my channel, and make sure to also click onto that notification bell for my weekly videos every Thursday. Until next time.